So we've already been over the actual full medical screening guide. We're now going to look a little bit more in depth about why we screen things the way that we do. So we've already answered these questions. So we've confirmed that we've read and agreed with that first statement. For this example, we're still going to say that we haven't got anything undiagnosed. We're not waiting for anything. So they're all no. So for the actual in-depth screening, so we're going to, for this example, we're just going to look at why we screen the medical condition rather than the treatment that you've had. So what we're going to use as an example is we're going to say that in the last year we have had a knee replacement. So I've ticked yes to say that I've had treatment in the last 5 years. And I've also ticked yes to say that I've had some sort of surgery in the last 2 years. And I've said no, the medication hasn't changed. We're just purely talking about the treatment that I've had. So as we've seen before, so we've got this little box that's appeared. So what we're going to do first is add condition. So rather than putting knee replacement, the reason that we had a knee replacement was because I had osteoarthritis, and that has caused the knee to wear, and then we've had the replacement. So let's pop in osteoarthritis. And as we've done before, we're going to press screen. So the first question that comes up, have you had any joints replaced or resurfaced? Again, there is a little statement here to clarify. So we are going to say yes. How many joint replacement or resurfacing operations have you had? We've just had one. So these questions are specific. So if you had said no to that first one, these questions wouldn't appear. So it does depend on how you answer them. Does it require you to use any mobility aids? No, we don't need any now. And are we waiting for any more replacements or resurfacing surgeries? No. Okay, and again, specific to the replacement, has it ever dislocated? No, it hasn't. Have you ever needed treatment for any neck or back problems? So again, we've declared the arthritis. So have we had arthritis in our neck or back? No, we have not. Okay. And then have we had any unplanned hospital admissions for this? So we've been in for the knee replacement, but that would have been a planned admission. So we planned to go in and have the surgery. We haven't had any unplanned admissions where we've been rushed in or beyond A&E. So we're going to say 0. And how many medicines do we take? Again, we're going to say 0. We're then going to continue. And what you'll notice, so we've declared the osteoarthritis here. And it's actually come up with this little subheading, joint replacement, brackets, non-trauma. So again, if we had have said no to a replacement, that wouldn't appear. It would just show osteoarthritis. But the reason we do this is that if we were to put in just the treatment that you've had, sometimes there's many reasons you can have a certain procedure or surgery. So we need to know exactly why you have had it so that we can score you fairly. So we can treat you fairly and then get you the best premiums based on your actual medical declaration. And then the other reason, if it did ever come to a claim, we would need to check your medical record and make sure it all matched up. Okay, but so now that that's all done, we can continue. And again, it does show up on the side here what you've declared.